The Spanish hospital of Aldebaran suggested not allocating ventilators to patients older than 80 years old during COVID outbreak in 2020, while the research conducted by Dr. Erdman Palmore among patients aged 60 to 93 years old found that in 43% of the cases, doctors treated their age as the main reason for their ailment, while in 9% of the cases, the patients were even denied medical treatment just because of their age. These all are examples of ageism. Have you ever heard about this? Indeed, while one hears quite often about sexism or racism, unfortunately, discussions about ageism are less frequent. However, a recent research based on the European Social Survey has found that ageism is the most prevalent form of discrimination. How moral is it? Should we discriminate older people in favor of youth, especially in such field with limited resources as healthcare system? In my opinion, no. I think that ageism in the healthcare system should be as unacceptable as sexism and racism, and I'm going to talk more about this in this video. In this video, I will consider ageism in the healthcare system as depriving older adults of medical treatment in favor of youth, or just providing worse quality medical service. And firstly, I'm going to begin with providing some arguments for ageism and trying to show why their logic is flawed. And afterwards, I will give some arguments why I think ageism is wrong and immoral. Let's start with the first one. The first one, utilitarianism. So according to utilitarianism, the doctor must act to provide the greatest happiness to the greatest number. So it makes more sense to save a life with more years ahead, that is the youngest one. All simple, but not really. So this argument and the logic in this argument is flawed for two reasons. First, utilitarianism says act to provide the greatest happiness to the greatest number, meaning to the greatest number of people. It does not say to provide the greatest happiness, the greatest multiplication product of the number of people multiplied by their life expectancy, by the quality of life on a scale from 1 to 10, etc., etc. It's ethics, not mathematics. Otherwise, we could have as well said that we should donate only to children in need and to nobody else because they have longer lives ahead. But that's not the case. And the second argument is that biological and chronological age are quite different things and often are different, and we cannot possibly measure how many years a person has ahead, and even an older person can live longer life than 10 years old child, for example. So we cannot measure nor the life expectancy nor the quality of this rest of the life, nor the how big the contribution of this person to society is going to be. So this argument is based on the wrong interpretation of utilitarianism and confused biological and chronological age. Therefore, it is wrong. The second argument, this one is an economic one. So we should prioritize younger generation in the healthcare system because they usually work more, pay more taxes, and make larger contribution to the economy and in particular to the healthcare system. And usually older people are retired, they do not work, and therefore do not make such a contribution. Well, according to this logic, quite the opposite should be right, and older generations should deserve priority in the healthcare system because they have already done their contribution. They have already made their contribution, and they have already paid taxes. The younger generation is only able to pay in the future. So this argument doesn't give a right to medical staff to discriminate older people in favor of youth. Finally, the third argument. Some people could possibly say, ageism is not discrimination at all, because if we live long enough, we're all gonna be old one day. So we should get prepared for such an attitude, and that we are going to be treated worse because of our age. And basically we discriminate everyone equally in that sense, and that is not discrimination. Well, that is not logical, because if we discriminate everyone equally, it's still a discrimination. Applying discrimination to everybody to the same extent, it doesn't make it something but discrimination. Otherwise, we could have accepted discrimination in salary because of the age, or we could have said that it's perfectly fine for an employer to fire a 40-year-old programmer just because he's now 40 years old and the employer doesn't like people who is older than 40 in his company. Well, no, it is still a discrimination. With that being said, I have provided the answers to these 3 arguments for ageism, and now I'm going to add 1 argument against ageism. Well, let's first forget about healthcare, clinics, hospitals, and think about human life in general. A person gets the same sentence for an assassination of 30-year-old man and 65-year-old man. In general, we do not value an older life over a younger one. I think just that 30-year-old man can be a thief, while 65, 70, or 95-year-old guy can be a noble chemist who has made and will make huge contribution to the society. So we cannot practically estimate and value and compare the value of 2 lives, and especially if the main and only criterion is the age. So we cannot possibly do this in general, and nor can we do this in a healthcare system. I have said a lot in this video, and I want to emphasize that I do not think that ageism in a healthcare system is bad just because that's a form of discrimination. Discrimination can be good as well as it can be bad. For example, letting children enter a museum free of charge is also a form of discrimination by the way of ageism, but that is obviously not a bad practice. However, ageism in healthcare is a bad practice. Firstly, because we cannot justify it neither by utilitarianism, nor by economic arguments, nor by saying that, well, we apply it to everybody to the same extent. What's the problem? And secondly, because it requires assessment of the value of human life just based on chronological age, which is more often than not is a mere number.